Hi, everyone, and welcome to the 7th session of the Let's Talk About Alternative Methodologies series. This session focuses on how you could continue to improve your use of your cost data, regardless if you are using a narrow cost analysis or an alternative methodology. I think everyone can get something from this session today. My name is Heather Madison, and I am from the National Center on Subsidy Innovation and Accountability. And we are happy to bring this series to you in collaboration with the Office of Child Care and the National Center on Early Childhood Quality Assurance. A few housekeeping items. The call is being recorded and will be made available to anyone not able to participate today. As participants, you can turn on your video and unmute yourself. However, we do ask that you remain on mute throughout the webinar. Please use the chat to ask any questions, and we will be answering them throughout the webinar. So as soon as it occurs to you what your question is, go ahead and jump in the chat and ask it, and we'll make sure to get back to it. If you're unable to use the chat to ask a question, we will have opportunities for you to come off mute to ask your question, and you can turn on closed captioning at any point to assist you. This webinar is part of multiple resources to support you in use of cost data. And at the conclusion of the webinar, you will receive a link for an evaluation. We encourage you to complete the evaluation and let us know what worked and what can be improved. Today, we're going to start with some introductions, and then we're going to move into what is continuous quality improvement, or CQI, and how does it relate to cost data? Why do we use CQI? And then we're going to jump right into a conversation with Hannah from Washington, D.C., and how they use the continuous quality improvement process to improve their use of cost data. So I am going to turn it over to Hannah to introduce herself, and then to Nina.
Great. Thanks, Heather. Hi, everyone. Good afternoon. I'm Hannah Matthews. I am the Director of Policy Planning and Research for the Division of Early Learning in the Office of the State Superintendent of Education in the District of Columbia. OSSI is the lead agency for CCDF for the District of Columbia. Good to be here.
Thank you.
I'm Nina Johnson with the National Center on Early Childhood Quality Assurance, and happy to be on this call with you all.
Great, thank you. So today's objective is to start understanding how to review, evaluate, and improve your use of cost data using a continuous quality improvement cycle. So first, we're going to just start with a quick check-in. Everybody can jump into this and share what's your favorite thing to do on a rainy day. So go ahead and jump in the chat and share what is your favorite thing to do on a rainy day. I know mine really is cuddling up under a blanket and reading a good book. Don't actually get much time to do that anymore, but when I do, it's pretty fantastic. Yes. Oh, a puzzle. Some other readers. Oh, yes. Oh, sitting in front of a fireplace. Yes, watching movies. Play with data. I love that answer. Definitely. Reading. Oh, so warm soup, puzzle. There's some pretty awesome ideas. And hopefully it's going to be a gentle rain. You have nothing to do, and we can all do these activities maybe this weekend when it's not freezing cold. All right, so we're going to move on. And so now I'm going to open up a poll. And the poll, I'd love for everybody to participate. The question is, what is your experience with continuous quality improvement, or CQI? You might have used it in multiple ways. Maybe you've used it, but not as frequently. Maybe you're aware, but have not used it. Maybe you haven't heard of it at all. I'm going to give it a little bit more time, but I see right now we have quite a few people that have used it in their work, but we have some balance and some people that have not heard about it at all. And so I think we're going to try to hit everybody today. And I'd love for you, as we're talking, to share your experiences in the chat or any questions that have come up for you. So I am going to go ahead and end the poll and share. So you can see we're kind of tied at the top with using it in multiple ways, or you've used it but not very frequently. And then we also have some that have not used it or have not heard of it. So we're going to dive right into what is it for those that have not heard of it or you're aware of it, but maybe just we'll do this little bit of a reminder. So I'm going to turn it over to Nina.
Heather, and for those of you who do use it on a regular basis, we'd love to hear you. I mean, we'd love for you to chime in the chat as we're talking about how you've used it, especially with regard to cost modeling. So I'm just going to talk briefly about what CQI is. We can move to the next slide. So a colleague of mine described CQI as a beautiful process today. And it truly is a beautiful process because it emphasizes the journey rather than the destination. We've embraced it in early childhood, I think, because we appreciate the cyclical nature of it. It's built around observation and data, which we love, right? And reflection, which we're good at. It focuses on the systematic and intentional improvement of services and outcomes, all of which we can get behind. So we use CQI in many aspects of the system, but in this conversation, we'll focus on how we can use CQI to improve every aspect of the cost estimation process, from gathering and analyzing the data to reporting and using it. This includes engaging providers, partners, and parents, and also it's focused on improving the equity of data collection and analysis and reporting. And as just a side note, I'm really excited to hear what Hannah has to share later on about how DC has thought about this. So on the next slide, you'll see that this illustrates the cyclical nature of CQI. You plan your approach for engagement, for data collection, and for evaluation, and then you do. So this includes the actual engagement, the data gathering, the analysis, and decision-making about the data. And then you study. So this is the fun part where you can review and think about what worked well and why did it work? How can we keep doing this? What didn't work as well? How's the engagement process going? Did engaged providers represent the state and the territory provider population? What data is missing? What could be expanded on? And then you act based on that analysis. So you apply what you've learned. And it's important to embed equity into this cycle. So this might mean that you're ensuring that engaged providers speak the languages that are commonly spoken in your state, that they represent the types of care that you fund, and that they come from different communities within your state. It can also mean identifying what data is missing or doesn't accurately represent a community, and also checking your assumptions with providers and partners and families. So those things are all important, and there are others too. And you can engage in the cycle of CQI as you're working on your narrow cost analysis or alternative methodology, and then continually refine it. So I feel like this process can be sort of done at a micro level, where you're continually thinking about, like, how is this working? How can we improve it as we continue to do the cost estimation? And then it can be done at sort of the end, even though there may not be an official end of the data gathering process and the reporting. So let's look at the whole thing and think about how we can improve it next time. I'm going to pass it back to Heather.
Great. Thank you, Nina. That was really helpful. So we're also going to talk a little bit about why we use CQI data. So we understand evaluation really is at the heart of data, and it's also at the heart of CQI. And it helps us support and understand how effective our cost data reporting and use is. As we learn more about equity and how we can all improve on the equity of our systems and the data that we use to improve our systems, CQI can help us inform over time the equity of cost data and use. Making big changes to the way subsidy rates are set or other system changes can be difficult to do in 1 or 2 steps. And so it can be more realistic to make smaller changes over time to move towards a bigger goal. And CQI can really support these changes while also incorporating the way that the childcare system in your state or territory can change over time. And also, it helps us make positive changes. Even when things are going well, we want to focus on how can we improve. And so we don't want to wait until something can go wrong. So I'd love for people, if you have additional reasons why you use CQI, to go ahead and jump in the chat, and we're going to, I can, check those out. We'll bring them into our conversation with Hannah. That is why some of the reasons we thought of why we want to use the CQI process. So now we're going to jump into our conversation with Hannah. And so Hannah, our very first question really is around, can you give us an overview of how you use cost data to inform subsidy rates and your childcare system changes in DC?
Sure, thanks. So the district has actually used cost modeling to set childcare subsidy rates since 2015. So we are approaching what will be our 5th cost modeling analysis. I think we actually don't use the term CQI. I don't know that we've consciously thought about doing that kind of analysis, but certainly every time we've done the cost model, which I can talk more about, we certainly have made changes and updates reflecting what we've learned. So done that informally without explicitly calling it that, I guess. I will say, for context, as I mentioned, the district has used the cost modeling since 2015 to set rates for CCDF. In addition, the district has local legislation that mandates our use of cost modeling to set subsidy rates as well. And there are a number of requirements in that local legislative mandate in terms of what needs to be looked at in the cost modeling that we're done and what gets reported publicly. So we are using it for the purposes of subsidy, but also much more broadly within our childcare system. Just to give one example of that, the district has a compensation initiative called the Early Childhood Educator Pay Equity Fund. We are explicitly using our cost model tool to be able to look at how the cost of care is impacted by raising the wages and salaries of the early childhood workforce through that initiative.
Interesting. So why did you initially start? And I know that, right, you might be able to talk to the concepts, but you weren't necessarily there because 2015, for some, doesn't feel that long ago, but it was a while ago. But why did DC start using a cost-based model around your childcare system and childcare rates?
Right. So I was not here in 2015, but I can say that I think, we believe in even more so now and have continued to believe, and I do think this was the impetus for starting it, was just that the cost estimation model is the best way that we have found to accurately and equitably be able to reflect the actual cost of care. And I think that's because we can adapt the tool for so many different model scenarios for providers, different facility sizes, based on how many subsidy kids are served, kind of all those different deviations really helps to have a much clearer picture of the sector. And I think that because we've been using it now for some time, it really has become a tool that our policymakers, our providers, our other stakeholders have come along with us, understand it, and it can really help them also kind of get more of a better financial picture of the sector.
Mm. Do you know if there were any specific goals or outcomes, right, is it just and not that it's a just, but really trying to get to that, what does it cost to really reimburse providers at that cost? Or are there other outcomes or goals that DC had or has?
Yeah, I'm not sure that there were specifically other goals. What I can say is it has been a priority for the district to really increase infant toddler care in particular. And so, again, the cost model has allowed us to think about that much more intentionally. And so, as we continue to pursue that goal, we can look much more closely at the cost of infant toddler care. We've been able to prioritize rate increases for infants and toddlers. And so, again, the flexibility that we have to kind of understand the role that rates play in the larger sector. I mean, I think the other piece that's important here is that I'm sure it's the same in many other states and localities, but most of our providers who receive subsidy are caring for a mix of subsidy children and private pay children. And so when you just look at increasing rates on its own, it's a little bit harder to get a clear picture of what difference you're making to the financial bottom line for the provider to just look at, we've increased rates by X%, but really being able to look at that cost of care and see how much our rate increases are actually impacting for a provider and think about the totality of resources that we're providing. So, we have other tools to use to support our goals around increasing infant toddler care, whether they are grants to help providers with facilities to expand their infant toddler classrooms, those kinds of things. So again, I think it helps us with a piece of the whole puzzle, and we want to be constantly evaluating that.
Okay, thank you. Can you tell us a little bit about maybe some of the assumptions that have been made in your alternative methodology around child care, and then any processes you've put in place around evaluating your success?
Sure. So I would say in terms of assumptions, I think, so what we have done when we use our cost estimation model and our tool is to run various scenarios. And I think we have really been able to refine those assumptions as we've gone forward with an understanding of the most common configurations, which may not actually reflect kind of just what we think of in terms of small, medium, or large program, but like understanding how much programs are enrolled, where they fall along, getting closer to full enrollment, different models because of how our ratios pan out. So again, kind of with a focus on infants. If there are more infants in a home, there need to be more caregivers. That impacts your cost model a lot. And initially, we were doing kind of a more basic, like I said, kind of small, medium, large facility, and have really tried to fine tune our assumptions about what the most common models of care provided really are in the district. And on processes, as I said, we haven't done formal evaluations. I think a lot of our processes are related to sharing out the information about our cost model analysis, sharing our report, and using the input and feedback that we get on that to then inform the next round. So it is a continuous cycle. We have also a number of kind of standing meetings, standing groups that we consult with who really are able to give us input into how we're designing the cost modeling. So I would say the processes of being in conversation with providers on an ongoing basis leaves us in a best position to fine tune the model.
And do you know if those standing groups that you consult with existed prior to using this cost-based alternative methodology, or have they kind of come into existence since? And it's okay if you don't know.
Yeah, some do and some don't. So, for example, we have a group that came together during COVID to provide kind of real in-time advice to the group that was here at the time. I wasn't, and that group has has evolved to provide input on a variety of topics, not just related to COVID. So.
Okay.
I had just a follow-up question, Hannah, about when you talked earlier about the sharing the report and then using the feedback that you got on the report to make changes the next round or improvements for the next round. Was that a formal process of getting feedback on the report, or was it more informal in that if you got feedback, you would be sure to consider that in the next round?
I would say most of our processes related to evaluation are really more informal. Yeah, I mean, we obviously do the formal input process related to the determining the methodology and all of that for the purposes of CCDF, but I think the kind of ongoing feedback is more informal.
Okay, that makes sense. Thanks.
So I think we've even started jumping into some of these questions about, how you engage providers and partners, but do you want to expand on that engagement of how you're, this informal process, but also your formal process? I know we have some people that are on the call that are just starting an alternative methodology or just starting their cost-based process, and I think that would help them understand how to, think about how to engage partners and providers.
Yes. So the starting point for our cost estimation model is our tool is adapted based on the cost of quality tool. So we update that with DC specific inputs as they're available. One thing that we did in our last round of cost modeling was to couple the use of the tool with a provider survey. And so that got us additional information, both on personnel costs. We were specifically really trying to get better estimates related to salaries and wages. So we used a survey for that purpose and updated some other cost assumptions within the tool. So that's one kind of example of a more formal way of engaging providers where we got the information directly from them. I would say another example of kind of the more informal adaptation is just as we're in conversation and learning how facilities are staffing their centers, for example, we made some changes to how our model accounts for which facilities have an assistant director role or how much time would be in that, So I think those kinds of things, like as we understand not just obviously our cost model tool accounts for the ratios that are in our licensing in terms of the classroom, but really getting a better sense of more broadly the other staffing roles, I think is really an important piece as well. We won't replicate the survey every time, so we aren't doing a survey again with this latest round, but I think, thinking about other ways to get information along with the cost modeling is a good kind of check on the inputs that are in there. Let's see. I mentioned kind of the ongoing conversations. We obviously do present our findings in more formal forums with stakeholders, with our State Early Childhood Development Advisory Council, and then can adjust our findings and input going forward from there. Let's see. Seeing if I answer the other questions. I think there is a lot of work that goes into working with providers and partners to understand what the cost model analysis says, what it means, and what lessons individual providers may be able to draw from it. I mean, ideally, we do hope that it's a tool that our providers can use to think about the fiscal reality of their own facilities and how they might adapt and make changes based on kind of what the model says. So that's an ongoing process. Again, I think since it's been done several times now in the district, it's something that folks are more familiar with. But particularly for stakeholders outside of childcare, I think there's a lot of work to do just to understand, you run your cost model and you might find that for most of your providers, they are operating in the red. Well, what does that mean, right? In childcare, we all know that that means that some staff are getting sent home early, that there are, there are expenses being put on credit cards, there are maybe other quality investments that are being put on hold. But people outside of childcare just see that and say, it can't possibly be that every childcare operator is like not making a profit. What does this mean? So, I think there's just a lot of explaining the numbers and what it looks like in reality.
Can
Do
you,
you have,
oh,
go
I'm
ahead,
sorry.
Nina.
Just a quick follow-up question. When you talk about the people outside of childcare, can you give some examples? Like, would that be legislators, for instance?
Policymakers, yes.
Okay.
Yep.
You asked my question, Nina.
Oh.
I was going to say that. Like, do you have specific populations in mind that you think of when you say, oh, outside of childcare? And is it policymakers?
I mean,
is it other partners as well that might not be
it could
right
be
in
other,
that
it
realm?
could be other partners. I think primarily I was thinking of policymakers, particularly because I think, what I hear from folks in other states that aren't using a cost model yet is that they do feel like this would be advantageous because it'll help convince policymakers of the need for investment. And while I think that is absolutely true, I think there's just a need to understand that it also takes a while to bring them along, that it won't necessarily be intuitive at first.
Yes, definitely. I've had that conversation of that can't be true. Do you have any specific partners? I mean, we've definitely talked about that you have partners and policymakers and providers that you work with, but are there specific groups beyond provider groups that you ensure that you are communicating with either on an informal or formal basis that others might want to consider?
I'd say it's the kind of usual suspects, right? Certainly providers, we want to make sure that we particularly reach different sets of folks. So those that are representing family childcare providers, that's one constituency. We presented on the cost model analysis to our Head Start Association and others. So I think just making sure to reach the full kind of gamut of folks in the sector.
Thank you. So thinking about what you've learned through the years of using a cost model, we talked a little bit about your evaluation, that it hasn't necessarily been a formal evaluation, but you've been doing it. So can you tell us a little bit about what you've been doing with that, how your childcare system has changed, and how that's impacted your process, and just how things have evolved?
Sure. So I think, as I mentioned, I think that the biggest evolution has been continually fine-tuning our assumptions and adapting them. So I can give, a couple of examples of that. One would be that we have really worked on a better and kind of more specific inputs around benefits that either may be paid by an individual facility. In our case, the district is subsidizing the cost of a health insurance coverage for employees of child development facilities. And so that was something that we wanted to make sure was included in the cost model, both to show the investment that's being put in, but that the cost would be borne by facility owners if in fact that wasn't a funding stream that the district was supporting. So we've worked to expand our assumptions there. One big change that happened in the last round of our cost modeling, we do have a quality rating and improvement system in the district. It's called Capital Quality, and the quality designations are entirely based on classroom observations. The previous versions of our cost model analysis had made assumptions about the salaries that teachers were making based on the quality level of their facility. In reality, we don't see that being a very accurate representation of the sector, that our highest quality facilities are not necessarily, sometimes, but not necessarily paying higher wages to staff. We also really were unable to put a dollar figure on the cost of meeting our higher quality designations. It's entirely based on teacher-child interactions. I think you could certainly make assumptions that, there may be costs that go into that, professional development, coaching, et cetera. But really, at the end of the day, there's not a hard cost to put on having a higher rating in your teacher-child interactions. And so we eliminated the cost differences across our quality designations within our tool, meaning that we don't think that it costs, we largely don't think that it costs different amounts across our designations. We did add a way to be able to do additional cost modeling if a facility, for example, is really supporting a broader set of high quality services, so comprehensive services. If the facility were to have, several of these positions, a coach, someone working with families on staff, there certainly would be higher costs. But we have that now as kind of optional within the cost model tool rather than an assumption about a certain level of quality. Once we did that, it also made us really interrogate our tiered rates. And so one thing that we were concerned about is the fact, and this is, intuitive, but our providers who were the furthest from quality were getting the lowest reimbursement rates. And as we think about supporting their quality improvement, that had equity concerns for us. And so what we were able to do is kind of based on being able to do this deeper analysis was while we still have 4 quality levels within our QRIS, we created just 3 tiered payment levels. We brought the bottom up to the next level, and we put the bulk of our increase in rates. We were able to increase rates for all providers the last round, and we put the largest increase into raising up the bottom, our providers who were rated at the lowest levels. And so for us, that was a really important equity adjustment to think about providing more resources to those facilities that may actually need more resources to move up in their quality level.
I have another quick follow-up question. When did you do that? Was it recently?
We did the cost modeling last year, or well, I guess the end of 2022 and the beginning of 2023, so about a year ago, and we're able to get the rate increase through as of October 1st.
Oh, okay, so it's relatively recent.
Yep.
Yeah, that's exciting. I was just curious if you'd seen a difference in providers coming into the system or staying in longer or just feeling more successful.
I think it's too early to be able to say that, but I would also add that we were able to increase income eligibility at the same time. And so part of the goal really was to expand our universe of subsidy providers to get more providers to be participating and taking subsidy kids.
Oh, that's wonderful.
So.
What percentage do you know of providers take subsidy children in DSA? Do you know?
It's about half of our licensed facilities.
Oh, okay. Do you know what the barriers are? And it sounds like some of these things you're trying to address the barriers with.
Certainly some are based on rates and income eligibility. I would say we also see some differences in the district is very segregated in many ways along different lines. So certainly we have providers in some communities where median income is much higher than our income eligibility, who don't see a need to participate. I would say we also have some providers who are reluctant to participate in immigrant communities, even though the vast majority of those children would be eligible for subsidy. I think we have a lot of education to do to make sure that families know they can access subsidies. So there are some providers that don't see it as relevant to their the population of families that they serve. We are as we work to expand eligibility, hopefully that is not an accurate assumption, but and we are working to, all of the other, I think, common challenges that you hear, right? Like this, paperwork requirements and all kinds of things. So working to address those as we can.
Right, definitely. So I'd love to kind of go back to what you had said about how you found that the higher quality programs aren't necessarily the ones that are paying. higher salaries. Have you, and maybe I missed this, but how do you account for, is it one of your goals to kind of increase the salaries that and the compensation packages that childcare providers, teachers, assistant teachers, directors receive? And how do you address that in your methodology, and how has that evolved over time?
So that's a great question, and it is an area that I think has changed based on the broader policies and systems that are in place. So I think, again, going back to the first couple of rounds, 2015, 2018, actually in 2021 as well, this is when the inputs in the model did tier salaries based on quality level. I don't know that that was a goal versus an assumption that that might be happening. The goal certainly is to raise wages across the board, as we know that they are woefully inadequate. The survey that we did the last round helped to solidify our understanding that there actually were not as big differences in salary as we thought. Unfortunately, that means there were more providers paying, closer to the minimum wage than we might have thought. So based on that, it kind of allowed us to, think about eliminating this factor. The other reason that we wanted to look at costs with salaries more equitable across designations is that the compensation initiative that I mentioned at the top of the call, the Early Childhood Educator Pay Equity Fund, it does establish minimum salary requirements for teachers and assistant teachers in those programs that opt in to participating. Those minimum salaries are based on credentials or degrees that the individual teacher or assistant teacher holds. So in other words, the minimum salary for someone with a BA is higher than that of someone with a CDA. But it doesn't factor in the quality designations. So it made sense to us to think about salaries as being more equal across designations, because the new program essentially sets a standard for salaries across the entire childcare sector of those that choose to participate in this program. So that was an evolution in the larger policies and systems in place in the district, which is why having the ability to kind of go back to the cost model and be able to make those changes relative to what's happening in the larger environment makes it an extremely useful tool for us.
Yeah, I imagine. That's so interesting to hear too.
And I'll add, because I mentioned earlier the local legislation that we have as well. One of the things that we were to use the cost model analysis for was to see how the increase in those minimum salaries, the establishment of that baseline of salaries, would affect the cost of care. So we are, specifically tracking the impact now. Right now, the difference between the wages that were paid and those minimum salary requirements is funded through the district. Obviously, if you weren't to do that, then that cost would fall to providers, but we can at least quantify what that difference is.
So it sounds like you're using your cost model on an ongoing basis. It's not
That's
necessarily a period of just collecting the data, putting it into the model, and then putting together a report, but like, let's play with this and see what this cost looks like with these salaries and these scenarios, and then what kind of revenue we need to put in the other side to even that out.
That's right. And I think I've said this on other webinars related to the alternative methodology, but I think it bears repeating. I really do believe that this whole process is, an art and not a science. And, just because we do the cost analysis doesn't mean that we have the revenue all of a sudden to bring every provider to be paying at the cost of care. But it does allow us to kind of think through what our policy goals are and how they reflect our rates. And so, the kinds of things that we've been able to do, like raising rates for infants and toddlers, raising rates at a higher proportion for our lower quality designated facilities. We are closer to the cost of care for family childcare than we are for centers. That's intentional. So all of those kinds of pieces, I think, it's just another tool to advance the larger goals that we have. And it's certainly not, it does not guarantee that we necessarily have the resources to have rates where we want them to be, but it helps us make more informed choices when we're setting those rates.
Mm. And you mentioned, right, that your priority is infant toddler rates, and I imagine that you found a very large gap there. Are there other big gaps that you have found between what those rates are or what providers are charging and what the actual cost is? Or has it been focused mostly on infant and toddlers?
So primarily it's on infants and toddlers, and that's because we do have a large universal pre-K program. So we, very much want to encourage children who are eligible for pre-K to be served through that funding stream. Obviously, they often have before and after care as well, but we really are trying to focus the subsidy system much more so on infants and toddlers. I would say the other gaps are, along the lines, I think, of what is typically found the difference between a smaller facility and a larger facility. You have those economies of scale. We are doing work around shared services with many facilities as well. So that's a way of, addressing some of those issues there. I think those really are the big ones.
Okay. Yeah. And just out of curiosity, have you found anything unique about school age care, or have you found the gaps to be the lowest? Just to, throw that age category in there.
Yes. I think it is where we've had the most variability in comparing our rates to the rates charged to private pay families. So I think there is more work to do to understand how aligned they are and what the gap actually is. That's been a difficult area to gain information on. I mean, similarly, I would say on our home-based providers too. I think that the modeling is just not as developed for homes as it is for facilities. So I think maybe I referenced, just there is when you're talking about a small home-based provider who is then employing an associate caregiver to care for multiple infants, there's just a dramatic difference in that cost analysis than there is if you're serving, one infant and some school-aged children. So that I think requires more modeling. It requires kind of more interrogating our assumptions about what that model looks like. And I would say that's an area that we probably have more work to do as well.
We'll be curious to see how you expand in both family childcare and school age care, because they are unique. And I imagine, every different configuration can have an impact on a cost model. So, we did want to ask about equity. And I know you've mentioned, just even economic equity and some diversity within, DC. But is there anything you want to improve on in equity or things you want to examine? And then also, did you have any surprises or unexpected insights that you wanted to share about your data?
I may have shared some of these already, so I'll try not to be too repetitive. Maybe I'll think of something else as I'm talking. I think on equity, I would say thinking more broadly about what we learned through other systems and applying it in the cost model would be kind of our next step. So what I mean is the modeling itself doesn't necessarily count for the kinds of factors that we want to consider around equity. We know that our facilities in certain areas of the district have higher needs. We know they're serving higher needs families. We also know there can be, children and families that are served by providers who are outside of their communities. What does that look like? I think, the workforce is the same. We have that same challenge. Sometimes there's assumptions about equity issues in certain parts of the district that are higher needs, but we have a workforce that is mobile. And so we have, educators who are working in facilities across the district and have needs for higher wages. So I think as we learn and collect better data from facilities, if there are things, this is, we don't have plans to do this yet. I think it's a question of how you would do this, right? Is that I think as we are gaining better data and understanding the inequities that exist within our facilities, thinking about how you would build that into a cost model. And maybe that's not the right tool. Maybe it's getting the cost data out of the tool and then thinking about how we apply it equitably. I mean, I think there are a lot of different ways to think about it, but I don't think that our current tool is necessarily, addressing equity to the extent that we would like it to.
Mm-hmm. Makes sense. I think if anybody has any ideas, we'll definitely take them in the chat. But I do think it is something that across the country, states struggle with how to capture the data to really understand the equitable systems.
I think the other piece that I would say on surprises or insights, when we did the survey that I mentioned with our last round of cost modeling, I think that ended up being, we originally were doing it to make sure that we, could update some of our inputs in the tool, and particularly looking at salary data, but we also asked for tuition data. And I think that, again, we are not using a market rate survey to set rates, but it's still really useful to have information on the market and also to be able to compare. We were able to do an analysis then that looked at our rates, the cost of care, and the price of care. And all three of those are very useful, even if they are telling you different things. And so I think for us, that was a takeaway of making sure that as we go forward, we don't entirely abandon a market rate survey, that we still need updated and current information on tuition, but that, we may collect it in different ways. And, we obviously interpret that differently than we interpret the cost of care. But I think that was a kind of a key insight for us, was that it really is useful to be able to do both of those and have the comparison data.
So does DC have a policy around payment? Do you pay the provider's rate or the subsidy rate, which is whichever is lower, or whichever is higher? Which one do you do? The whichever is lower, so you would pay the provider's rate if it's lower than the subsidy rate, or would you pay the subsidy rate regardless of the provider's rate?
We pay the full subsidy rate to the provider.
Full subsidy rate. Okay. So from that perspective, from the cost model, setting your rates is really based on true cost and not having to accommodate for the fact that a provider may only still get their private rate. So I think that's just a important concept for those states that are still paying the provider's rate if it's lower than the subsidy rate, because that can impact the amount of income that a program is receiving, even if you do raise those rates. So I did see a couple questions that I want to go back. So one was, have you cost modeled for school age care only programs, and how does that look if you've done it?
We have not. We've modeled for both centers and homes that care for different configurations of children, including larger ones that include school-age children, and our family homes that include school-age programs. So the short answer is no, we haven't looked at that independently.
Thanks. And Nina, do you want to go ahead and ask your question?
Sure. It was more just a reflection when we were talking about considering equity in the cost model itself, and that it might be helpful to consider both the resources and the needs of the community in which the provider lives and the families live. Because it could be that the families need more comprehensive services or are in need of referrals. This may require more time of the provider. It may be the case that the community doesn't have the resources that other communities have, and so the provider has to transport the kids more often than other providers do. I feel like all this translates to a cost in terms of time or in terms of other costs, and it's just a matter of like really talking with providers and learning about those additional needs.
So that actually makes me think of something else to share. I think that's a great point, Nina. We are just going to be launching a grant program to provide funded slots to child development facilities that are caring for children with special needs, just with a recognition that the subsidy rate as it is does not provide enough to be able to meet the needs of those children. And so that's going to be a new source of information for us to actually see what facilities do need, like what are the costs for caring for kids with different medical conditions, with different disabilities, with different needs. And so again, that's something like our cost model itself doesn't factor in if you need a lower ratio to accommodate a classroom for inclusion. It doesn't, account for those kinds of additional staffing costs that there may be for serving particular populations of children. So that would be another kind of next, I don't know, 2.0, 3.0 of the cost model is to really think not just about classroom configuration, but about students, children, and their needs, and how you account for that within the cost model. That's a good point.
That will be interesting to learn.
I will. So we did also get a question about, because your subsidy rate, you pay your subsidy rate regardless of the provider's rate. So if it's higher, the provider receives it. Does it impact the subsidy client's copay contribution? So would they still pay their copay even if the provider receives that a higher amount than they charge? Is that clear what I just said?
Yes. I'm worried I'm going to answer this incorrectly. I
imagine it depends on the provider. So I don't want to, right? It's not necessarily a global, but does it change your copayment from the perspective of policy? Or is the copayment what the copayment is?
So the copay is based on children and the household income. Our copayment, our rate structure is also based on the provider type. So we have what we call level 1 and level 2 providers. Level 2 providers can do subsidy eligibility and intake and enroll children through subsidy that way. Those providers receive what would be the family's copayment share from us. So they really get the full subsidy rate because they get the portion that the district pays and the portion that a parent would pay. The level 1 providers would be getting from us the rate minus the copay, which then, would be up to them to get from a family. So our copay policies are structured based on the provider type.
Okay.
So essentially that because those level 2 providers are doing that extra work of being trained and able to do eligibility, they are getting that compensation, that extra compensation in the form of the family copay. They don't have to go, collecting that from families.
That's really helpful. An interesting approach. So just kind of to wrap up our questions, I'd love to know, I mean, you've told us a bit about the changes that you have made, that you're thinking about. Are there any changes specific to the CCDF plan cycle, and kind of how you're, or, how you're spacing out some changes that you're making this year versus in future years that you'd like to share?
So our biggest change for this cycle will be updating the salary data to reflect new minimum salaries for the district. So I think that's just going to, tell us a lot about the cost of care in facilities. Again, the wage it's being supplemented by public funding, but that will be the biggest change in terms of kind of what the cost model looks like. I think in the future, it's hard to predict what else. I do think the last, bit of the conversation that we've had around equity is something that we are very interested in. I think all the pieces that I've mentioned, if there was more that we could do around special populations, if there was a better way we could, really look at home-based providers, I think those are all areas that we just want to continue to improve, to go back to the theme here.
Great. Well, thank you. Nina, did you have any other questions?
No, I don't, but thank you so much, Hannah.
Okay, thank you. Well, I want to thank you, Hannah, for joining us. I know you're very busy, so I appreciate this time, this hour that you've taken with us, and all of what we have learned from you. So thank you. So we're going to just take the last couple of minutes of the webinar and kind of summarize what we learned about, which is, CQI is used throughout the cost data process. As Hannah shared, they're doing it all the time. They're constantly going through that cycle. In some ways, very informally, but also formally doing, starting that process again. That they have made some positive changes, so they haven't necessarily had anything break, but it has helped really make some different changes because it's informed. Right. And as those changes have happened, they've been able to incorporate those changes into the cost information and continue to have that information. Equity of data and participation in the process can always be improved. Something we're all learning about, and is something that we'll all explore ways that we can do this. And it really does help support making incremental changes over time. And I'd love for you to share any of your aha moments in the chat as well, if you have any that are in addition to the ones that I summarized. And so I'm just going to do some reminders. We do have a page on the Child Care Technical Assistance website around alternative methodologies and using cost data. Tons of resources. There's also all of the recordings. This is the 7th of our Let's Talk series, and 1 through 6 is recordings are posted there. So if you want to go back and review them, they're there. And this recording will also be posted there within a few weeks. If there are some questions you still have, or you would like some help, technical assistance is free and is available to the states, the CCDF lead agencies. You can request it by talking to your regional office, or we've also put the link for the technical assistance request form here. On that page I just shared before, that on the Child Care Technical Assistance website, these PowerPoints are posted. So those links are in the previous PowerPoints if you need them. And I just want to thank everybody for joining us. Thank Nina and Hannah again for sharing with us your knowledge and your experience. And remind everybody, please fill out the evaluation. It will pop up once you leave the meeting. We do use that information to inform the technical assistance, the products, and the webinars that we offer in the future. So please take time to complete the evaluation. And thank you, everyone.